So my dad grew up in Bosque County, Texas. He grew up on a cattle ranch there when he was a kid. At 18, when Pearl Harbor struck, he volunteered for the Army. Except for that brief period of time where he fought in World War II, he pretty much lived on the ranch there in Bosque County, which is the very northern part of the hill country. It's very rural, and he lived there his whole life. Very rustic individual, worked hard. He died at 93, but literally ran the ranch up until the time that he died. But the problem is there's no surgeon on call. Okay, so it's July 4th, that's a Thursday. There's not going to be a surgeon on call till Monday. And so there's no opportunity to get that surgery done in the hospital that day. So, began to realize then that all those boxes of being checked off of things that needed to go correctly were starting to break down, because at this point, he hadn't eaten in 40 hours. We'd already repeated tests. Now he's on narcotics. He's in a strange environment. He's in a hospital. He's going through the typical scenario that many people do when they go into the hospital. Clearly, I was on the other side. And I saw it from the patient's perspective, and I think that nightmare and that story continued to the next day. Where this was now the next morning, and surgery doesn't happen, and it's noon, and surgery doesn't happen, and at 3 o'clock in the afternoon of the next day, we still haven't even seen a physician. Typical scenario, Saturday. Everything in a protocol, everything in a hospital is dictated by protocols. And so, part of that is time to get up, drips, and physical therapy. Well, part of it's physical therapy is twice a day, get up out of bed. But on a Saturday, they only have physical therapy once a day. So the first thing that happens is he doesn't really get out of bed the next day. That really started, I think, the beginning of the end, because, not getting up, having this trauma and stress of surgery, not eating in 40 hours, and you're 93. And stuff starts to snowball, and even though it's little things, they start to add up to starting to make a bigger problem.